resound loud as the rolling sea. Sing a song full of the faith that the darkness has taught us. Sing a song full of the hope that the present has brought.
Long may we reign, still we rise. Thank you.
Ladies and gentlemen, good evening. We are the NAACP Forum. We are Brockton's choice for civil rights news. I have a distinguished panel with me this evening to discuss My Phobia is Real. This distinguished panel not only comes from the healthcare part of the work the great work that's being done in our country, but they come as personal activists as well. I want to begin to introduce them. First, let's start with President Michael Curry. Michael Curry serves as the president and CEO of the Massachusetts League of Community Healthcare Centers, which represents 52 healthcare centers serving 1 million patients and 314 practice sites. Community healthcare centers were born out of the modern civil rights movement by physicians and researchers, activists who wanted to bring quality, affordable healthcare to communities and populations. He also serves on the board of the National NAACP. Michael chairs the board's Advocacy and Policy Committee and is the past president of the Boston branch of the NAACP. Michael Curry was appointed by the Massachusetts Senate to the legislative created Health Equity Task Force, which he now co-chairs, which is aimed at addressing healthcare disparities that have now been realized and magnified by COVID-19. Recently, Michael helped to launch and serve on the Harvard T.H. Chan School of Public Health Community Coalition for Equity and Research, a collection of researchers, community activists, and leaders. Michael is also advising companies, nonprofits, academic institutions, and pharmaceutical companies on healthcare equity, as well as diversity, equity, and inclusion issues. He is frequently called upon to provide quantum leap presentations, which introduce audience to the history of anti-Black racism from 1619 to today, and includes connecting the dots between medical experimentation, segregation, and mistreatment, unequal treatment over centuries, and the distrust of African Americans to take the COVID-19 vaccine. Joining me are well-renowned physicians. We want to start with Bisola Ojukwu. If I've said that wrong, I hope she charges to my mind, not to my heart. But Dr. Ojukwu is an associate professor of medicine and global and social science at Harvard Medical School and an associate physician with the Division of Global Health Equity at Brigham and Women's Hospital. She's also a faculty member within the Infectious Disease Division at Brigham and Women's Hospital and the Massachusetts General Hospitals. Recently, she has focused her efforts on increasing the participation of racially and ethnically diverse populations in COVID-19 research and promoting vaccine uptake. She is currently funded through a collaborative partnership with the RAND Corporation dedicated to developing strategies to address COVID-19 vaccine hesitancy within the Black community in the United States of America. Also joining us is Dr. Chandler. Dr. Chandler also has a master's in public health. She's a primary care physician at the Phyllis Gen Center of Primary Care, an assistant professor of medicine at Harvard Medical School, and an associate epidemiologist in the Division of Preventive Medicine at Brigham and Women's Hospital. I am now tongue twisted. Thank you, panel, for joining me this evening. How are you all? Oh, get off of mute.
Great, we're doing great.
We're good.
So listen, what I tell people in the work that I've done on the NAACP firm, we're gonna have a conversation as if you're sitting in my living room. Please feel free to not necessarily talk academics, but talk on the level that people will understand the message that we're trying to send out with respect to this work that needs to be done around the vaccine. So let me just give people a background. The Boston Globe reports that the Massachusetts State Police employees, 800 of them have declined the COVID-19 vaccine. Europe is reporting that there have been adverse immunization effects with respect to the AstraZeneca COVID-19 vaccine. And we know here in the US in 2007, I think it was the vaccine B was recalled. 1.2 million doses were recalled with respect to that. But with all of that said, that's some bad news. Michael Curry, tell us, what is the history of medical research with respect to African Americans in the United States?
Well, that's a deep question, and we would need a whole segment just on that. I think, what I think has come out of this pandemic and the murder of George Floyd is a reckoning in many ways, right? What our criminal justice system is, how it's treated people of color, African Americans particularly. It's our education system, it's our housing, it's our the environmental injustice in our communities. And part of that conversation in the last year has been this awakening around America's healthcare system and how it's treated people of color, and I'd say more particularly African Americans. So, people are starting to dig into crates, as we say, and look at things that they never even knew about, or maybe understood as a embedded in their distrust, but they didn't know the details of. So you've had years of research. Some friends of mine and others have written about racism in the medical field. Dr. Coleman, who used to live here, I think she's moved. Dr. Clayton, I meant to say. And others have written about this stuff. She was talking to me a decade ago about her and her husband's book on racism in healthcare. So I think right now people are talking about J. Marion Sims. I had a colleague talk about how they worked out of an office that was named after the father of gynecology and his experimentation on Black women. Those names, Anarcha, Lucy, Betsy. And he's only one anecdotal story. But of course it makes sense, because if you think about 1619 to 1865, if you could experiment on anybody, who would you experiment on? Right. People who are less than human, who are 3/5 human beings. You couldn't experiment on white women at that period. You could experiment on white women if they had a medical condition and it was a life-saving opportunity to treat them in some experimental way. But you had Black slaves. So whether we know about J. Marion Sims now, as young people challenge these monuments to Robert E. Lee and J. Marion Sims in Central Park, people are asking that those statues and those monuments be taken down because of the reckoning we're talking about. But then, you can walk through history with Tuskegee syphilis, and more people are understanding the injustice of that experiment that happened over decades, that went through the early 1970s, that basically didn't treat men for their syphilis. Because we were viewed by science, not by quack doctors, but by science, as being the syphilis-soaked race, that we had bad blood. It wasn't about our environments, it was about our race in their eyes, right? So we now, even if you didn't know all that history, we all have lived experiences that tell us that when we go to doctor's offices or we go to hospitals, we don't get treated the same. We don't get prescribed the same. Maybe we get our legs amputated. We think there's some other course of treatment. We all have a story, right? If you're Black and you're brown, you have a story of a bad experience with your family. And that's why, my aunts would say, don't go to that hospital because you might not come home, right? Well, I'm not getting that clinical trial. I'm not letting white folks experiment on me. And we've grown up with that, and it's embedded in their lived experiences. So Tony, to your point, and to those listeners on the call, Dr. Basola and Paulette, Dr. Chandler, really know the depth of this research. This is what they do. I just, as from an activist standpoint, get to share a little bit of that history and talk about we are distrustful because the health system has not been trustworthy.
Well, President Curry, so is the phobia real? I mean, are you saying that the phobia is real?
The phobia is real, and we have to balance two. We have to walk and chew gum at the same time. So the phobia is real. The inequity is still real and baked into our healthcare system. It is experienced today by somebody right now in our healthcare system. But at the same time, we got to have a conversation about where we are. And we are where too much death, too much hospitalization for Black and brown people, and we have a vaccine that could save lives. We have to be able to have both those conversations.
Dr. Chandler, you heard President Curry talk about equity. Tell us a little about what is this word we've been hearing over the last year? What is healthcare disparities? What does that mean?
So when you think about disparities, you think, okay, there's a difference. There's a difference in outcomes. There's a difference in reception of care. And for health disparities, there's a difference in health outcomes. For example, when you look at the death rate of Black and brown, 2 to 3 times the rate of whites in the Boston area from COVID-19. So you're like, okay, well, what's driving this? Well, we know that there's structural issues. They're crowded, overcrowded housing. That's a big issue. That was one of the main big risk factor. Essential workers having a type of job where you're exposed because you're a frontline worker to the risk of contracting COVID, exposure to COVID. And we know that Blacks were, and Black and brown people were more likely to have these essential worker type jobs. And then you think about, use public transportation, and then the long legacy of, how the government created these ghettos. They funded them and prevented Blacks and Black and brown people from moving into certain areas. So you have the economics, you have the environmental, and the social injustices that create these unequal outcomes. So it results in health disparities, meaning more people die, more people likely to have obesity, diabetes because of the food deserts. You think these communities often don't have access to fresh food. Right. You don't have Whole Foods or Stop and Shop along Blue Hill Avenue. You have, just small little variety stores. Or right. You go to any city in the Black communities, you don't see these nice grocery stores. And then the violence in our communities too. So many things contribute to these disparities, meaning unequal outcomes, unequal burden of disease.
So Dr. Ojukwu, you've done some extraordinary work nationally and internationally, especially, around HIV populations. And one of the things that we're facing is really messaging. How have you been successful in your international work? I'm going to go international on your international work and messaging people that, listen, the HIV cocktail works. Listen, you need to be protected. Listen, you really need to do your follow-up. How have you been successful in getting the message across, and how can that apply to messaging around the COVID-19 vaccination programs?
So, first I would just start by saying that there are numerous parallels between the HIV epidemic and what we're currently experiencing with COVID-19. I think it's really important for us to think about the fact that we've been through something already that should teach us how to move forward. So there are really 3 parallels that I'm going to mention first. So one is that if you think back to the HIV epidemic, when it first started, many of us are old enough to recall sort of in the early and mid 80s, that it was very misunderstood and underestimated. Nobody would have predicted that 38 million people now, some 35 years later, would be living with HIV in the world, and 33 million people have died. You see, and if you think back to the beginning of COVID-19, nobody really was thinking that it was going to go this far, and there were going to be so many deaths and, so much, after effects in terms of hospitalization and severity of disease. The other piece is that we, certainly have noted the similar pervasive disparities by race and ethnicity. And then the third piece is this issue of misinformation and conspiracy theories and disinformation, which is what you're talking about. Right. These things that are being spread via social media, via word of mouth, that are very concerning, and you have to get over them. So internationally, and domestically, I think there are 2 strategies that have been used and really have been promoted by, and really raised and elevated through the HIV epidemic. One is really developing very close community partnerships and community engagement. And sometimes people sort of overlook how important that is, actually having communities talk to each other, talk to themselves, because those people know what they want to hear. They know what makes people who look like them, who talk like them, who have their same experience actually change their mind about behaviors or experiences and get them to engage in different interventions. The second thing, which is similar to the idea of community partnerships, is really using peers, and peer navigation and peer exchange. Because the thing is that no matter how many mass vaccination sites, no matter how many mobile clinics, no matter how much rollout we do in community health centers, there are going to be networks that we as trusted messengers, as physicians, or as community leaders like Michael is, we're not going to get in those areas. So you have to use peers, people who are part of those networks, to talk to each other. So I think these are 2 strategies that have been well utilized and utilized very successfully in terms of HIV, both internationally and domestically, in terms of messaging and actually getting people to do things that they wouldn't normally do, that they were hesitant to do, as we were talking about today.
So Dr. Ojukwu, just a follow-up. So do you think the use of, and I have to ask this question because people have suggested, Do you think that the use of Oprah Winfrey, or the use of President Obama, Michelle Obama, taking the vaccination really, really helps? Or is that just too star-studded? I need to ask.
Mm-hmm. No, I think that's a great question. So there actually is data that using celebrities actually works to a certain extent. But think about it this way. No, but think about it this way. There are many people who are on the fence. Those people, sure, you can easily tip them over the fence by doing something with celebrities, making them feel more comfortable in a slight way, whatever. But there are a whole lot of people who are on the other side of the fence. They're way away from wanting to be vaccinated. Those people aren't going to be turned into, believers by Oprah Winfrey and Obama and Beyonce. That's not going to work. You see, you have to think about different strategies for different people and for different levels of skepticism. And we have to put in the kind of effort to understand those people who are very skeptical versus those people who are on the fence. Right. You see? Right. So I think that's the point. We need to use everything in our toolbox, but for different things for different people.
And Tony, just one quick point on that. So the data also tells us that the people that they want to hear most from are people like Dr. Ojikutu and Dr. Chandler. They want to hear from the doctors, the researchers.
Yes.
And quite frankly, if you're Black, you want to hear from some Black researchers and doctors. You want to hear from some Latinx researchers and doctors. And then there's a cascade of others that fall below that, whether it's the medical associations or Dr. Fauci or the health centers or hospitals. There's a whole cascade of folks. So I call it a chorus. Right. You need the whole chorus providing that information and saying, get the vax. But we need to lead with our doctors. And I just wanted to stress that point.
So President Curry, it's really about credibility, right?
Absolutely.
It's about credibility.
And we think about it all the time. We go to a doctor today, and I tell people this, and please, Dr. Ojikutu and Dr. Chandler, most of the time we defer to you all the time anyway. So we don't know the science behind the hernia operation, no matter what you're trying to do, we have to defer and trust. And the reality is that this is one of those moments that we need to get the facts as much as we can, and then trust our leaders, right? I always lift her up, Kizzmekia Corbett, the Black woman who was a part of the team that helped get us to this moment of a vaccine. There are people at the CDC. We have Black folks, brown folks, in the whole development of this vaccine. We did not always have that in history. So while we reflect on history, we have to draw a contrast to where we were in the past to where we are now. And we now have a seat at the table. It doesn't mean you don't need to ask tough questions. It doesn't mean you don't need to come to the table with all those things you got online and ask those questions of the doctors who are with us today.
Right.
But once you get your answer, then we need you to do what's in your best interest to save your life.
So, President Curry, let me just ask you this question. One of the things that has come up over the years, and when we talk about the medical research of African Americans, everybody reminds us that it was legal. Is that true? Was the research actually legal?
Well, it's so funny when you think about, and that's part of the intro you made about Quantum Leap. The reason I do the presentation Quantum Leap, and I bring people from 1619 to 2021, is that they forget that the mistreatment of Black people was legal, right? It was law, right? So if you're talking about slavery or Black codes during the end of the 19th century or Jim Crow for much of the 20th century, you're talking about legalized abuse, experimentation, murder. I tell people all the time, we proclaim Black Lives Matter because over most of the country's history, Black lives didn't matter.
Right. Right.
So it's not about all lives matter. Over most of this country's history, documented, our lives did not matter. You can murder us, not fire us, not feed us, not provide the same health care, and there were no repercussions for that because our lives didn't matter. So therefore, hence why we need to, in this moment, revisit that past, reconcile with that past, and then figure out how we hold the healthcare system accountable going forward. So yes, legalize experimentation, of course, right? History's full of that. But here's where we are now. How do we? And I would say this to Dr. Ojikutu and Dr. Chandler. I've even toyed with the Institute of Medicine's report to err is human. All the medical errors that happen in the field of healthcare. I would argue that probably many of them were in our communities. Were circumstances that Black and brown patients experience. and they probably never got what was coming to them in terms of recognition that there was an error, a proper payment for their pain and suffering. That's a whole nother conversation that most people haven't even started talking about. And they focus on the Institute of Medicine's unequal treatment report. They don't even talk about the medical errors and how that has impacted Black and brown communities. So there's so much to unwrap, Tony, and it is a legal conversation as well.
Right. So wait a minute, Michael, I don't want to let you go now. Wait a minute. So you just talked a little bit about economics. So is there any possibility to get reparations or some sort of, is there any economics around reparations that we can talk about, or is that just too far along?
So
you're gonna have medical error.
You're gonna have to come to my presentation, Tony, when I do Quantum Leap. So I give you the whole reparations, 15 slides, and it's not just about slavery.
Right.
It's short-sighted if they think that reparations is about slavery. There is a solid, growing argument that reparations is about all of that, from Black codes to Jim Crow to redlining to restrictive covenants to medical mistreatment. All of that bundled together is what really kept Black people from building wealth, from living as long as white families. All of those things are now becoming recognized, right? And now there's a conversation, as Sheila Jackson Lee had her bill last year on reparations. First time that bill had gotten a full hearing in Congress. Now you got Bob Johnson talking about reparations. You got presidential candidates debating reparations. Right. Our kids will not be as turned off by this conversation as our generation or the generation before us.
Thank you, President Curry. So let me just ask you, Dr. Chandler, one of the things that President Curry had talked about was history and the contrast. So one of the questions that I wanted to ask you, in my looking at the HBO series on Henrietta Lacks, when you talk about medical ethics, especially when it comes to the African-American community, has anything changed? I mean, I don't want to be so negative, but has anything changed?
Right. So a lot has changed since the 1950s when Henrietta Lacks had her cervical cancer cells harvested. You can't just take somebody's tissue and put it in the lab and start doing experiments on it. You have to get approval. You have to get consent. And it's, a written consent for that type of tissue transfer. Also, even if you participate in a trial, like her cells now have been used in all sorts of experiments, the patient has to give consent, or the participant consent to even enroll in a trial. And then once you're in a trial, there are, like for a clinical trial, there's a data safety monitoring board that's monitoring the outcomes to make sure that no one is injured from the intervention. And those data safety monitoring boards are independent of the investigators that are conducting the trial. So there are a lot of different pieces that are in place. For example, like even with the COVID-19 vaccine trials, the 4 historically Black colleges, they said, look, we're gonna be monitoring things also to make sure that you're treated honestly and fairly if you decide to enroll in the trial. So, Meharry, Howard, Drew, and Morehouse, they stepped up. So then you have these independent organizations. You think about the community organizations that are also weighing in on how trials are conducted. And of course, there's a community advisory board that becomes part of a study. They are involved oftentimes even before the trial is rolled out to weigh in, okay, well, how should this be done in this particular community so that they are respected and honored?
Thank you, Dr. Chandler. Dr. Jakutu, I've read, unfortunately, recently, too many white papers that suggest that the African Americans' complaint with respect to what has happened in terms of research is extremely exaggerated. There are some white papers out there that suggest that we are just exaggerating. What do you say to those who suggest that African Americans are overreacting when it comes to getting the COVID-19 vaccination? No, we're supporting people getting it, but what do you say to those that say we're just overreacting? I know.
So, okay, first of all, the fact that white papers such as the one you described even exist is a form of structural racism. I mean, that's what it is. Right. The issues that have already been discussed and that Michael's outlined, that Paulette has described, mistrust is real because it's a normal reaction to a horrific and horrendous history and a contemporary situation. What's happening right now, it's just bad for Black people. Right. So there is a reason for us to be skeptical of new innovation. It's not just COVID-19 vaccines, which is why we probably shouldn't be so focused in on vaccine hesitancy. This is mistrust of the healthcare system. This is mistrust of it is what it is. It's mistrust of all of these institutions. So I think that's ridiculous. It's interesting though, if you want to talk about mistrust and you just want to look at it over time, mistrust is something that exists within a social and political context, right? Mm-hmm. And what I mean by that is that it changes over time. So there was a period last year in the middle of the political campaign, the presidential campaign, where mistrust or basically confidence in the vaccine was only 30%. Then post the election, it tended to rise, and right now it's actually gone up to somewhere around 60% of Black people are saying, well, maybe I'll get this. Right. And we also know that if you look at most surveys, most people, Black people, are saying, well, you know what, I'm just going to wait. I'm just going to see how this plays out. So the thing is that it's not static. It's about the world around us. You know what I mean? It's about what people see. It's about the information that they have. And I think the reality is that I think the main point that I want to make is that it's normal. Maybe I don't trust. People in the medical field, healthcare workers are not taking the vaccine. So it's normal and it's valid. And I don't want people to discredit that, because I think that experience needs to be acknowledged in order to address it.
So, I know you've been crisscrossing the Commonwealth, and I've heard you on a lot of radio shows, but let's get really to the nitty gritty here. What truly is the implication if the African-American communities are not going to take this vaccine? And one of the other things that a lot of people have been calling me about is this thing called herd immunity. Can you first tell me a little bit about what's the implication if we don't take the vaccination in terms of our community? And what's this herd immunity that some people say they're waiting for that to happen so they don't have to take the vaccination?
Well, I'm going to use a basketball analogy.
Look at Paul. Paul is just laughing.
I'm going to use a basketball analogy, Bishop, for this.
Okay.
One, which is I'm a Scottie Pippen in this game, and I'll know when to pass the ball to Michael Jordan. And we got two Michael Jordans to answer that question on herd immunity, what it is, and our movement towards that. And I think, seriously, I think the doctors are the experts on that. The only thing I will say is we have to be very clear what the implications are for Black people when we ignore science, right? This has an impact on people across the globe, right? The infection levels across the globe should shock you, should terrify you. The hospitalization rates across the globe should shock you and terrify you. The death rate, like it was in 1918 from the Spanish flu, the death rate now, as of this very moment, should shock you and terrify you. It's not normal for people to die like that. The death rate, the hospitalization rate in this country, in Massachusetts, in Boston, and it's too many of us. So some people on this call may not have someone close to them who died of COVID-19, but just know that too many of us are dying and are hospitalized. We have to put that in context and realize that, but for the grace of God go I, knock on wood, do whatever you need to do.
Yes.
At any moment, you could start to have conditions or symptoms of COVID-19, and you'll be in the emergency room and you won't be able to say goodbye to your family. And then you won't even be able to have a proper burial because of where we are in this disease and this pandemic right now. I need people to take that in, and I need them to take this seriously, because we're dying and we don't have to die. And that's as simple as it is. And it's truth. It's the unfiltered truth. So if we ignore this disease, we have more price to pay. We already know our death rate is higher. Yeah. Our lifespan is lower. We are losing our wealth. We're losing our Black businesses. Reopening could be further along or further distant for us than it is for other communities. All of this is true. Our kids aren't learning. Achievement gaps are growing. We have too much to pay, but not reaching what the doctors will describe as herd immunity, so that we can get back to living our lives and doing what we need to do.
Dr. Chandler, what is herd immunity?
So you can think of herd immunity as when you have enough people that have taken the vaccine so that your risk of getting the infection, if you are not immunized, you're protected because you have enough people around you that are not infected, that are not giving you the virus. So you can think, you know, there've been different numbers in terms of what the goal is. You know, some 70%, 80% people need to get vaccinated. And we know some people will not be able to take the vaccine, but at least if they're surrounded by people that have received the vaccine, then they'll be protected because the circulation of virus in the community decreases as people are vaccinated.
Well, Dr. Chandler, I'm going to tell you, your answer concerns me because I've heard people say they're waiting for herd immunity. They're waiting for that. You're not suggesting that, though. You're not.
No, they actually they have to be part of the solution.
Solution, right?
So if they're waiting for herd immunity, I know because I have these young guys. They tell me, "Oh yeah, why can't we just get herd immunity?"
Yes.
I'm like, well, you have to be part of that. If that's what you want, that means you need to get vaccinated.
So, Dr. Chandler, when you look at research in general, especially, I think some of your work you've done is around colorectal cancer, but when you look at research in general, and when we look at the connection between research, or at least the connection between research and getting the COVID-19 vaccination, I think I'm asking the question correctly. My point is, are we participating in medical research even after all the stuff that Michael Curry has said has occurred in our generations? Are we participating?
Well, I mean, there's the issue of, distrust. Am I going to be a guinea pig? And when I invite my patients to participate, they say, oh, no, I don't want to be a guinea pig. Whereas some do say, I want to be part of the solution. So there are different camps. So we need to make sure that we don't assume that people are not going to participate, because some people say, oh, if I'd known about it, I would have participated. So it's important to extend the invitation, but also acknowledge that people that are invited, they need to see people that look like them, that are doing the research that helps. And then we have to foster those community collaborations so that we're not just showing up to harvest data. Instead, we want to have a reciprocal relationship where they're getting something out of it, we're getting something out of it, and we're building something better together.
Thank you. Thank you. Dr. Jakutu, you were recently featured in the Boston Globe article, and I must say I read the article. You are very straightforward. So your quote is, you said, this is your quote, historically, crises have lasted the longest in Black communities. Bostonian is worried that COVID-19 will be no different, Why are they lasting so long, and how do we fix this?
Well, I think it's everything that we've talked about thus far. I mean, you have situations where, clearly there are already these disparities, which Paulette described already, that are at baseline in our communities. There's already inequitable access to healthcare. There are already challenges in communicating and working with the healthcare system and uptake of interventions because of what we just said, this issue of mistrust. So there are already all of these challenges, and then you add one more whammy on it. You add, a COVID-19 or an HIV or something like that. And then what happens oftentimes is there's oftentimes not enough resources that are put into overcoming all of these challenges as we move forward to address the new challenge. Sometimes we do things that are maybe considered to be, short-term or superficial to deal with the immediate challenge, not thinking, well, there's a whole lot of other stuff that perpetuated or that promoted this immediate challenge. So, I think it's complicated, but I think we need to think in a visionary way. I think we need to think beyond just this immediate need to get everybody vaccinated, to figure out how to deal with all these other issues that's, sort of created the disparities that have been amplified. And that really does take, some visionary leadership, some thinking, some planning, some resource and capacity building within our own communities. And I think it's challenging. And that's why, these crises tend to last longer and be pervasive within our communities as opposed to others.
Thank you very much. President Curry, you need to talk to me about empirical data. So tell me a little bit. I know your organization has sponsored a few surveys. So tell us a little bit about what are the surveys telling us about mistrust? What are the surveys telling us about hesitation? Who's really hesitating? And what do we do to build trust moving forward?
Yeah, so Tony, thank you for that question. One, I just want to say credit to the Brockton NAACP and you, Tony, for having the doctors on tonight. When I tell you, I've been on with them a few times, and I'm always in awe whenever I'm with them. I'm not exaggerating. This is real.
Good.
And I'm just so thankful that the Brockton family is inviting them in for this conversation. And Tony, you did your research, man. You quote people from articles. So, Tony, I would say, the data told us during the summer that half the population wouldn't take the vaccine and that larger percentages of Black and brown people wouldn't take it. We did a survey in the fall with Museum of Science. That means the Mass League of Community Health Centers teamed up with the Museum of Science. Mass Inc., the entity that does polling, did the survey, and it told us something different that we now hear in national polls, which is that most people will take it. They just won't take it right away. Oh. So some 80+% say that they'll take it, but they're waiting to see what happens to you, Tony, first when you take it, right? They're waiting to see what happens with other people. And that, that's what we are. We're cautious, right? You got to prove to me that something would work, especially if you've not been trustworthy, right? I gotta wait to see what happens there. So that was good news. And then we've seen several national polls that reinforced that local poll that said that Black and brown folks generally will take it. Now, we know that plays out differently with race, with gender, with political party. The big news in the last 2-3 days is that large percentages of white male Republicans don't plan to take the vaccine.
Right.
Because they've gotten caught up in the hype that this is not a real disease and all that other stuff, which is why they've been trying to push Donald Trump to come out and say, hey, I got the vaccine, you should do it too. Right. So his followers will take the vaccine. So there is some real stuff. It's not just Black folks. Early in this pandemic, people got on Black folks for Black Twitter saying that Black folks are saying this is not real. White folks were saying the same thing. Right. And they were equally as duped as Black folks were early in this pandemic to say it wasn't a real pandemic. It was made up. So that survey in the fall told us something that we needed to hear, which is that we got to do our work. We got to basically put the information out. We got to meet people where they are, at the grocery store, at church, at work, and we need to share the science with them. And then over time, and I created my little survey from the healthcare workers and some of these other groups, somewhere about 1 to 3 months, it could take to move somebody to that place where they, as Dr. Ojikutu said, where they say, I'm over the fence, but you got to give them the information. Right. So I have way too many stories of people who said, I was going to take it, but my husband won't take it. And I took it, and 3 weeks later, a month later, he said, okay, fine, I'll take it too, right? So we got to make sure that they start to see people who look like them, people who have taken the vaccine, tell their story. One last thing on that is the survey revealed that some of the hardest people to reach were Black women, Black and brown women.
Really?
And the way I describe that is this. When I grew up in Lenox Street housing projects, if you wanted to do anything into my family, you had to go through my mother first. So our families, Black women, have always been the healthcare navigators, quite frankly, for us and white families. That's a whole nother untold story. But they've been the patient healthcare navigators for Black families. And for that role, that means you need to speak to them first before you get to grandpa or before you get to the son or the daughter. And then if you're an immigrant family, it could be that 13-year-old girl or boy that's helping to navigate for the whole family as well. So you may have to go to that Cape Verdean grandchild or that Haitian grandchild or that Russian grandchild to get to those parents. So we just need to be very strategic with all of this.
Thank you so much for that. Dr. Chandler, the question of the hour, are these vaccines safe?
Yes, they are safe. I mean, now we have, over 100 million folks that have been vaccinated in the US, and we have the clinical trials. We went through the normal phases of a clinical trial, and the data was rigorously, reviewed. The side effects have been reviewed, and now we're not seeing major deaths as a result of the vaccines that have been rolled out across the US, nor are we seeing major complications. There was great, fear among people. I won't even go into all the different fears that people have, but they are not playing out. So that's very reassuring. And we know now that one of the biggest predictors of whether someone gets the vaccine is how many people around them have already received the vaccine. So as it's been said, when you see someone else take it and they don't get injured, that others take it. And we have data to support that they're safe.
So what do you say for those that are making the argument, especially when I've been doing politics, but those on the conservative side, which is kind of weird because it was President Trump's warp speed. But so what do you say to those that say warp speed may have created that may have had the FDA make some unsafe decisions just to get the products out?
Right. Well, the key thing is that there were no shortcuts in terms of reviewing the data. Remember, millions of dollars were poured into these studies. So that's one reason they were more rapid. The other thing was the international collaboration across countries. Once they, found how the genes for the virus, they shared that information. Two, the trials were overlapped. Usually you might do an early trial where you're looking at safety and might not overlap it with an efficacy, meaning how well it works. But the trials were overlapped. The other thing is that multiple studies were going on simultaneously. I mean, like for a Moderna trial, there were 100 sites nationwide, so you could easily accrue these large populations, like about 30,000, Pfizer about 40,000, and then they were happening on multiple continents too. Right. So you have, and then of course there was aggressive recruitment of individuals from various groups so that the results were generalizable across different groups: Blacks, Latinx, elderly, those with underlying health conditions, hypertension, diabetes, because people say, oh, well, I have hypertension, diabetes. Will that vaccine work for me? Well, thankfully, those individuals with those different illnesses were included. All comers.
All comers. I like that. All comers. Dr. Ojikutu, as we move forward to answering some of the questions out in the chat, let me just ask you this. And I think this question actually applies to all of us here. Can you give me an example of a personal story, a personal success story where you've had someone successfully take the vaccine?
Well, I could actually give you a number, but yes, I mean, I can. And really the examples that I'm going to give are patients of mine. But what I would say is this, and I would, think about this as a process. This is not a one-time interaction that I've been having with, some of my patients. Literally, these are people who I know. These are people who trust me as their doctor, as their Black doctor. And they're people who, come to the table with a lot of other issues, as many of us do, right? So in one instance, I'll talk about a patient of mine, this was back in the fall, right when so the phase 3 trials were still enrolling and we didn't even have all the data, but I was talking to some of my patients already. And, this particular patient said, hey doc, I'm not taking this, so don't even mention it, And I said, well, why? And then I listened to their concerns. They said, these vaccines, I've seen them do bad things. I've seen, things happen to Black people, and I don't want to be involved. I trust you in other things, but this one, no, I'm not doing this, right? and so we ended up having a subsequent conversation. It's lucky I do see my patients because I'm a physician. I see patients, primary care and other patients quite frequently. So I saw them a few months later, and the person said, I heard from other people. I listened to you. I watched some of the things on the YouTube or whatever, and I feel a little more comfortable. Tell me a little more. So see, it was a process, right. And this relates back to what Michael said. It's really give people time. Give them the respect to have them empower themselves with knowledge. And if you give people that time and allow them to interact with trusted sources, then there are a lot of people who are going to eventually want to take the vaccine. So that's been my experience. I don't know about Paulette or Michael or anybody else, but that's been my experience.
President Curry, any personal success story? Somebody was reluctant and you were able to convince them to get the vaccination?
Yeah, the person who probably comes to mind the most, and I don't know if I convinced her, but I was on a phone call with her when she said she wasn't taking it, was Dr. Thea James at BMC. And, she's become really the poster child for taking it, right? She and I, about 2 months ago, were talking about the vaccine, and she said, I don't even think I'm taking it. Oh. And then, she really got some time of her own to dig in on the science and think about it and think about the implications for her community and the role that she plays in convincing others to take it. And about a month later, she was, doing an ABC interview talking about taking the vaccine. So I think to that point,
right,
we had to, not we, but meaning society had to convince Dr. James, an emergency room physician who sees death, who saw COVID-19 up front, close, like the doctors on the call, the doctors on this Zoom tonight. And she still needed time to get there. So this is about respecting people's process, as Dr. Ojukwu said, and letting them get there when they get there. And I tell people, and from a policy standpoint, Tony, I tell people those closest to the disease should be closest to the vaccine. That means Black and brown folks. That means socially vulnerable communities. That means communities with high prevalence. And then if Tony doesn't want to take it in January, you should have a fast pass to take it in March. Because we know that your community is disparately impacted and we need to make sure you get it, which that fast pass concept should be part of our policy on getting this vaccine out. The only other thing quickly, Tony, I would say, because I'd be remiss if I didn't say it on this call, is resources. The Department of Public Health has a question and answer guide on much of what we talked about tonight that you should go on the Massachusetts Department of Public Health website and draw down their toolkit, their question and answer. But I'm gonna give you an even better one. Dr. Lauren Smith, who's a sister who is worked for BMC. She was at Department of Public Health. She's a friend, and now she's the head of the CDC Foundation. She made me hip to this other toolkit that was produced by the Center for Black Health and Equity and the American Lung Association. So for all your listeners tonight, I need you to go to centerforblackhealth.org. And again, that's centerforblackhealth.org. And it's the COVID-19 toolkit that you want to download. It'll answer your questions. It answers it by Black people, for Black people, in a context that we need to hear it. And whether it's Queen Latifah or Derek Johnson, the head of the NAACP, the president of the NAACP, or Kizzmekia Corbett, it is full of stories and graphs and charts and data that you need to get to your own decision.
Wow, thank you for the information. And folks, don't forget to go back to our NAACP, the Brockton area NAACP's website, because on that website and Facebook page, we're going to be asking the question, have you been convinced to take the vaccination after hearing this program? But Dr. Chandler, do you have any personal success story of somebody that was reluctant and you were able to convince them?
Yeah, my mom would be an example. I have patients also, but
no, do the mom.
Yeah, she's from Georgia and she grew up, Jim Crow and everything. So she's like, oh no, I'm definitely not doing that vaccine. And why are you working on that? And so, but she was sick and had what probably was like COVID. And afterwards, her friends actually started calling her. She lives in Maryland, but she was up with me. And they said, are you getting that vaccine? I can't wait for it to come out. And she's like, well, what if Black people have been excited about a vaccine, but they had seen their family members die? And so then we did an event at the Suffolk County Correction House. And I told her how I shared about the black toes. One of my friends is an anesthesiologist down in Georgia. He said, oh yeah, seeing these black toes coming in. And I told her how the prison said, oh, I don't want those black toes. When is that next vaccine clinic? And so when I told her that story, she goes, oh, can you please get me signed up for that vaccine? And she was all set. And that really changed it. But of course, it was over a period of months that, I had the discussions with her. And then her friends were calling her also and encouraging her to get the vaccine when it was available.
So similar to what Dr. Ojukwu was saying, the process, it takes a process. Wow, thank you for the information. So we have a couple of questions here. One of the ones that's standing out to me that actually is very concerning to me is a person posted in the chat, and this is for the physicians. I'm allergic to the flu shot, and my doctor recommended that I don't take the vaccine. What do I do? Is this a common theme?
And Tony, before they answer that, because I think the other one in the chat that I think is important with the flu shot is the differences between the vaccines. So we can, because I think they can answer both of those.
Yeah.
So let me jump in first, and then Paulette certainly can jump in. So they're really, I think, first of all, when people pose questions about their individual situations. I think I'm going to answer this in a very general way because I think that's important for all of the listeners, okay? I think that there are two contraindications to taking the COVID-19 vaccines that are currently authorized. One is if you have an allergic reaction to any component of the vaccines, and the particular components that people are concerned about would be something called polyethylene glycol or polysorbate. We don't need to worry about that particular issue though. I think if you have any, when we vaccinate people, and both Paula and I have served as vaccinators, we ask, have you had any sort of allergic reaction to anything that is injectable? And then we would ask further questions, okay? So you would be evaluated. That's my point, to give you some reassurance. The second thing is if you have, because the 2 of the 3 vaccines that are currently authorized have 2 doses, right? So if you have an allergic reaction after that first dose, then you don't go and get the second dose. Do you see what I mean? You would not go and get the second dose. So those are the 2 important contraindications. The other piece that I think is very important that should help reassure people is that if you're a person who comes in to get vaccinated and you have a history of having allergic reactions to really anything, we're going to have you wait for 30 minutes, okay? Oh. Everybody else waits for 15 minutes. And the reason that we have people wait is because most of the reactions that one would see in association to vaccinations would happen sooner rather than later, right? So and at these sites, you're authorized to have emergency personnel. You know, we have a whole sort of group of emergency medicine, EMTs. So the technicians are there. People are watching you. You're socially distanced. It's a controlled sort of environment. Okay, so that's what happens when you go and get vaccinated. You are evaluated. You get the vaccine, and then you are monitored. Okay, so I think that should help people feel more comfortable sort of with the process.
Dr. Chandler, one of the questions that has come up, and Michael has alluded to this, is people are asking, what is the differences between the different, how many vaccines are out there right now, 3 or 4? 3?
So there are 3 that have been approved for emergency use authorization, 3 in the US. Okay. So you have the Moderna, which is 2 doses. You get the dose at day 1, dose at 4 weeks later, day 28, that's messenger RNA vaccine, which is like think about it as like a recipe for how to make the spike protein, which allows the virus to enter your cells. So there are 2 that are messenger RNA vaccines, Moderna and Pfizer. Moderna, you get dose day 1, 4 weeks later, you get dose 2. Pfizer, you get dose day 1, and then 3 weeks later, you get dose 2. They are similar in terms of how well they work and protect from infection. Remember, all 3 viruses prevent severe infection and resulting in hospitalization and prevent death. 100% protection for severe hospitalization, for severe COVID and death. And then you have Johnson & Johnson, and that's an adenovirus vector, a cold virus that's been activated, and the recipe for the spike protein is put into the genetic material of that virus. That one is just 1 dose, so 1 and done. So a lot of people like that because it's only 1 dose. Right. A little bit lower in terms of protection, but again, it's 100% protection for risk of death and hospitalization for severe COVID. So all 3 would be good ones to get. Whichever one you can get your hands on, whichever one you have access to would be reasonable. Now, of course, you have allergies to the polysorbate, polyethylene glycol, then you wouldn't want the Moderna or Pfizer because both of those have that material in there as an ingredient.
Dr. Chandler, let me just ask you this question. Let me just give you a bit of information. As you probably, all of you are aware, Marvelous Marvin Hagler passed away. And one of the things that Tommy Hearns did, one of his competitors, is immediately posted that he died from being vaccinated. So his wife has come out to contradict that. So we're getting a lot of these questions. Has anyone died from the vaccine? Has anyone died from the vaccine?
I mean, we don't have absolute evidence that they died. And there's Hank Aaron. They said, oh, he got the vaccine and he died. But, people die every day from a host of different reasons. So they could die, true, and unrelated. So we don't have absolute evidence that, oh yeah, the vaccine caused their death. We do know that there are some side effects that people have had after they've had the vaccine. People like to highlight the doctor down in Miami that got the vaccine, his platelets dropped and, he died. And we've seen other cases where the platelets drop after the vaccine. That may be a vaccine reaction. We don't know, but it is being evaluated.
Thank you,
and Tony, can I just follow up with both the doctors and maybe Dr. Chandler on this? The question is, do people die of the regular vaccines for the flu every year, right? So do they die of every other intervention we have for every disease? And there are isolated cases of all that, right?
Can I also add, because I totally agree with everything that Michael and Paulette have said. I just want to emphasize it because I think it is just so critical.
Yes,
we are going to hear about people dying, people having side effects, like we just talked about with this AstraZeneca situation. We're going to hear about these things. We can't always assume that it was because of the vaccine. Right. We can't assume that it's more of cases of something because it just so happens that people are having a side effect and it just so happens that they receive the vaccine. I think we just have to take all this information along with all the other information out there and make a decision and make an informed choice. I mean, we don't want severe COVID or death from COVID. So we need to kind of balance, and make that decision. And we're going to hear a lot more about the vaccines, and things change every day. So hopefully we'll have more of these sessions to update people and keep people, sort of in the know about what's happening.
And what's really disappointing is if someone ends up hospitalized on a vent and before they get ventilated, they said, wow, I had a chance to get that vaccine and I didn't. And that's a sad story. And that's preventable because the vaccines do prevent hospitalization from severe disease.
So getting the vaccination is what we all ought to be doing. Is that correct?
Mm-hmm.
Absolutely.
Michael Curry, closing argument. You have 1 minute.
you give me it because I'm the lawyer on the call, right? No, I think the case has been laid out by both doctors. Is listen to the people who are here for this moment, right? This is, we use this context in the issue of race, meeting the moment, right? The Breonna Taylor, the George Floyd. This is also about healthcare, and we have to meet the moment. We have to save lives. We have to wear masks. We have to continue to socially distance. We have to take the vaccine when it's our opportunity to take it so we can get healthy and we can get back to living our lives. We can get back to raising our kids, going to school, going to work, making money, raising wealth, building wealth. And we're not there right now. This disruption is significant to Black families across the country and, quite frankly, across the globe, because the disparities we're seeing out here in the United States are also playing out in other places. So we are closest to the disease in way too many other countries as well. We need to pay attention to the science. We need to listen to the doctors. And when it's our turn, step up and take the vaccine.
Michael Curry, Dr. Ojikutu, and Paulette Chandler, I want to thank you for joining the NAACP program. You guys have given us an extraordinary wealth of information. We need to take the vaccination. The vaccination saves lives. I want to thank you. I want to give you a hand clap and say God bless you to all three of you for the great work that you've done. We are the Brockton Area Branch NAACP. We are the NAACP firm. We are Brockton's choice for Civil Rights News, and we thank you all for joining us. Have a good evening.